So, Andy, could you tell us a little bit more about the briefing that we've launched today and what we were setting out to discover?
Yeah, so we wanted to try to look ahead at what the likely mental health implications of the current crisis would be, particularly thinking about the long term, trying to understand what we can find out now about the mental health needs of the population as it stands and what we're likely to see in the near future.
Okay, great. And kind of like briefly, how did we go about trying to do that?
Yeah, so our research team looked at the evidence that we could find. And inevitably, it's still an emerging situation. There's not a lot we can say for certain, but what we have been able to do is look back at research into two really crucial things. One of which is previous epidemics of things like flu in other parts of the world, where there have been kind of major outbreaks, and there's been research on their mental health impacts. And the other is on previous recessions. And we know that the economic cycle is really important to our mental health. So we looked at those and then tried to bring that evidence together to do our first attempt at forecasting what we think is to come.
Okay, and what were the sort of headline findings from that analysis?
So what we've been able to identify is that there are significant risks to mental health as a result of this. And many of us are experiencing a lot of stress and anxiety and worry at the moment, and that's a perfectly natural thing. But there is also good evidence that there are longer term impacts, particularly for some groups of people, and they're both those who are directly affected by coronavirus and also those indirectly affected, for example, by the lockdown and the loss of work. What we're expecting overall at the population level is roughly 500,000 more people experiencing poor mental health this year than might have been expected if this hadn't happened. But again, the actual numbers we'll only know as time goes on.
Of course, yeah. And how does economic and potential sort of economic trajectories from here, how does that interact with our predictions?
Yeah, so we know that both unemployment and being economically precarious are big risks for mental health, and indeed inequalities in wealth are very clearly things that affect our chances of having good or poor mental health at any stage in our lives. So we know that what happens to the economy, whether we have a major recession and what the nature of that looks like and what safety nets are available for people, will be really important, and particularly if we get multiple waves of the virus which cause a really deep and lasting recession, then that will have a particularly additional effect on people's mental health, both now and longer term.
Okay, that's really helpful to know. And you mentioned earlier that kind of this won't be, that not all groups will be affected equally. And what are the groups that we are particularly worried about in terms of the mental health impact of the pandemic?
Yeah. So I think there are really three groups of people that we're concerned about. And first of all, it's those who are directly affected by it. And that includes people who've had the virus and particularly been treated in hospital. We know that being treated in intensive care in and of itself creates a risk of experiencing trauma symptoms for some time afterwards. I think we're also concerned about people who are bereaved by it. Bereavement is, again, a natural part of life for all of us. But at this time, when you're perhaps not able to grieve in the way that you would normally, it is likely to lead to a higher risk of poor mental health longer term. And of course, people working in health and care services, many of whom are experiencing traumatic things every day at the moment. So people directly affected. But there are also groups of people who are at higher risk and will be feeling particular stress at the moment. So people living with long-term health conditions, for example, and people from Black, Asian and minority ethnic communities who are seeing very much higher rates of being affected by the virus. But then there's a whole range of groups of people who are indirectly affected too. So those who are economically precarious, those who are living in overcrowded housing, for example, or substandard housing, people who are experiencing violence and abuse, which may be heightened at this time, and people with existing mental health difficulties for whom this can be particularly challenging.
Okay. And what would you say from the centre that our kind of key asks to government are as a result of the analysis that we've done?
Yeah, so we've got four things that we're saying to government are really important that need to be done and can start now. The first is that the government has taken unprecedented steps to create a financial safety net for people, and we really welcome that, and we need to see that extended, and we need to see that last for as long as is needed, because we know that that is likely to avert the worst effects of the economic downturn. Secondly, we need government to help schools, businesses, communities to really understand the traumatic experience that many people are going through, and to help to create a sense of safety as people go back to normal life, or whatever normal life looks like. I think thirdly, we're wanting to see specific services set up for people who are most directly affected, and proactively reach out to people who have been in intensive care or people who've been bereaved. And then finally, we want to encourage the NHS to plan for either a single wave, which we hope will be the case, we hope there won't be further waves, but also to be prepared for the mental health impacts if there are multiple waves of the virus, which will have a much more serious effect on our mental health. And we think if we see these changes, then we can help to both protect and promote mental health at this very difficult time, but also meet the needs of those who are going to be struggling the most.
Okay, thank you so much for that. As ever, there's lots more information on our website, and you can find the briefing and download it for free there. But thanks so much for your time, Andy.
Thank you.